there, I'm Dr. Danny Leonard, a baseball physical therapist at Eclipse Wellness in Sterling, Virginia. So I just want to talk about an important topic that I'm seeing a lot of on social media, and I wanted to cover my thought process with it, and that's baseball-specific assessments. So assessments are kind of all the rage right now. If you go to any sort of facilities, Instagram, TikTok, anything like that, they're probably talking about all the cool things they do, testing your strength, testing how you throw, all that kind of stuff. And I think that a lot of people have good ideas. I just want to talk about how I look at it as a baseball physical therapist, strength coach, as well as a baseball coach at Eclipse Wellness, how we try to bring those three worlds together, looking at the biomechanics from a physical therapy perspective, the strength, power, mobility from a strength coach perspective, as well as the impact on the field from a baseball coach perspective. So I want to take you through what assessments look like at Eclipse Wellness, my thought process, and why we do them. So the first part of any good assessment, in my opinion, is a thorough history. So as a doctor of physical therapy and medical provider, I am well versed in taking histories. That's obviously part of any sort of assessment. If you go see the doctor, they're going to ask you, when did you start hurting? What's going on? When did you start feeling sick? This is the number one thing I see a lot of strength coaches as well as baseball coaches miss, is they want to just jump right into the cool physical assessments, move and everything like that. It's important to understand where the athlete's coming from as well as what they're thinking so that you can know where you're going to go. So the two big things I want to look at in history are injury history and training history. Injury history is pretty obvious, but if you tweaked your hip a year ago and it's still bothering you a little bit, and I watch you squat, I should be able to pick up on, okay, you're not putting as much weight in that hip, maybe you can't internally rotate as much when you squat, something like that. But it's good to know that stuff ahead of time. It's also good to know why those limitations are there and what you're thinking about them. Because I'll see some athletes who are like, no, my hip's fine, I don't worry about it. Clearly your hip's not fine. Or some who are saying, oh, I'm hesitant to load that. That gives me a little bit better idea of what you're thinking, what you're doing. The other thing I want to look at is training history. So I see a wide range of athletes, especially with baseball players. I see some who all they do is lift heavy. They go to the gym 5 days a week, maxing out everything like that. Maybe their mobility is limited because of that. Maybe their power is limited because of that. Or I see some athletes who are told, oh, I don't want to get too bulky. I'm going to do a bunch of band exercises with my arm. I want to know your training history so I can understand where you're coming from, but also what your expectations are. Because if you think that you're going to get too bulky by bench pressing, and I just tell you, hey, your upper body strength is weak, we need to work on bench pressing, and in your mind you're thinking, whoa, I don't want to do this, this guy doesn't know what he's talking about. I need to know why you're thinking that. If someone told you that, whether as a parent, coach, Instagram, whatever it is, just so we can get to the bottom of that. I also want to know where you are in your baseball kind of journey. Now, I just posted a blog about the start of the off season and how I like to do an assessment being in the off season to give you an idea for training. And that's a great time to train because there's no baseball. You can really hit the weights hard. You can hit mobility hard, stuff like that. If we're in the middle of June and you're coming to me for an assessment and next week you have a showcase for the college that you want to go to, it's probably not the time where I'm going to be like, hey, let's try 5 new exercises and see what happens. And you go out there to pitch and you're really sore and you can't throw as hard as you want. So the big thing that I see medical providers miss is where you are in your baseball journey, because the off season is much different than in season, especially depending on where you are in season, what your goals are, everything like that. So a history should cover your injury history, your training history, as well as your baseball history, so we can know going into the assessment, what are we looking for, what are we trying to accomplish. So the first thing that I want to actually test when I'm doing an assessment of someone is power, because baseball is a power-based sport. It's short sprints, it's hard movements, fast, and then a recovery. You're not a distance runner, so we shouldn't test you like a distance runner. We need to test your power. And I want to break it down into 3 components. I want to look at upper body, lower body, and core, and see how all 3 are moving to better give us an idea of what we're looking at training-wise. So the simplest one to understand, and honestly the most important, is lower body. So the best way to measure power that I find in lower body is to just do a vertical jump. So just jumping up as high as you can, seeing how many inches off the ground you can get. Now I like to look at 2 different types of jumps. A counter movement jump, which is just going to be a regular jump. So think about if I said go as high as you can, you're going to squat down and jump up high as you can. The other one is a squat jump, where you're going to get down into the low position, hold for about 3 seconds, and then jump from there. The counter movement jump is going to be looking at your explosiveness, your elasticity of I'm bending and exploding, versus a squat jump is I'm stuck in this position, where do I move from? Another test I like to use for lower body is called the triple jump. So you're going to do 3 broad jumps as far as you can, and you're going to measure each of them. You're going to compare the first jump to the third jump. If the third jump increases by at least about 20%, that's showing you're also a very elastic athlete. Similarly, the counter movement jump should be at least 20% higher than the squat jump. So what we're looking at is what kind of athletic profile you have. I use a lot of stuff from kind of TPI and On Base U. They like to use the analogy of gorillas versus gazelles. So if you think of a gorilla, very muscle-bound, very muscle-based athlete. So the gorilla is going to do the squat jump and the counter movement jump, and they're going to be very similar. It's going to be the guy who rebounds that you see just sticks his butt out and does this, and then jumps up from there. Think about like a Albert Pujols type swing where he's just loaded here, and then it's all muscle-based coming through. The gazelle is going to use more elasticity. So their counter movement jump is going to be a lot higher. Their triple jump, by the time they get to that third jump, they're like a gazelle bouncing where they're going to get some more momentum. So that's going to be a more elastic or kind of tendon-based athlete. So like a Gary Sheffield type swing where there's just constant movement. And if you stop, you lose that power. So you just got to keep moving and grooving. Or like a Johnny Cueto pitching where there's going to be a lot of movement coming through there. So it's good to know what kind of athlete you are. Younger athletes, we want to try to even them out as much as possible because we want to make a well-rounded athlete. You're less likely to get injured. If you're someone who's very gazelle tendon-based, we might want to work on some general strength because that might help you accentuate your strengths. Older athletes, sometimes it's a little bit tricky of what we want to play into, what we want to accomplish. But that's kind of what we're looking at with lower body and also upper body and core. Upper body test, very simple. We just grab a medicine ball. So what I like to do, and it comes from the folks at TPI, is base the poundage on your weight. So for every 20 pounds you weigh, add a pound. So if you're 200 pounds, you want a 10-pound ball. If you're 160 pounds, you want an 8-pound ball. All you're going to do is you're going to sit in a chair and you're going to do a chest pass as far as you can, and you're going to measure the feet that it goes. Pretty easy. That's just isolating your upper body power of how explosive you are in doing that. For core testing, what we do is we use that same medicine ball, so based on your weight, you're going to do a sit-up and throw. So you're going to have it up over your head. You're going to do a sit-up type movement and throw the ball as far as you can from the ground. Once again, you're going to measure how many feet it goes. You're going to compare the core, the upper body, and the lower body. The feet that the upper body chest pass, as well as the lower body sit-up and throw, should be roughly equal to the inches of your vertical jump. If there's a big discrepancy, you're probably weak in one of them. So if your sit-up and throw is really low, you probably need to work on some core power and explosiveness, and that might be what you're missing from your swing or your pitch. The other thing that I like to throw in to test core is more of a shot put throw, side to side. So I'm seeing more and more athletes who have been playing baseball exclusively, and they're becoming very asymmetrical at a younger age. So if you're someone who always swings right-handed and throws right-handed, you're probably losing some power from the left side. So I'll have people just do a simple shot put throw as far as they can from one side, and then the non-dominant side. I like to see the non-dominant side within 80 to 90% of the dominant side. If there's a big difference, like you try to go left-handed as a righty, and it goes like 50%, then we better start training to go the other way because that's going to make you more explosive as an athlete and prevent injury because we need to develop that other side of your core and how you're moving to protect when we're swinging, when we're throwing, stuff like that. So that's how we test lower body power to give us a good idea, and upper body and core to give you a good idea of where you are as an athlete. From there, we're going to look at strength and mobility to kind of complete the whole picture. So if we do your power testing and we see there's limitation, whether it's your lower body, your upper body, or core, we want to figure out if that's a strength or speed issue. Now, it's easier to test strengths. That's usually what I'll defer to. What I mean by that is if you're doing a chest pass, and your chest pass, your upper body power is limited, we want to look at your upper body strength. If you're not strong in doing like a push-up or chest press type movement, it's probably why your power stinks, is you just need to get stronger. If you are really strong, then it may be a speed issue. We need to work more medicine balls, quick movements to work on that power because that's what we want to translate to is that quick motion of swinging, throwing, things like that. So how I test strength is using a dumbbell for everything. And once again, you need to know your body weight for this. So if I'm testing your lower body strength, what I have you do is grab a dumbbell in each hand. We're going to do a split squat type movement. So I want you holding about 50% of your body weight. So if you're 200 pounds, then you're going to need a 50-pound dumbbell on one hand, 50-pound dumbbell on the other. We're trying to do 8 good repetitions of split squats each way. If you can't do that, then we probably need to work on lower body strength. Now, of course, we work on power as well, but we're going to focus on strength. If we're talking about upper body power, you struggle with the chest pass. What we're going to do is we're going to do a dumbbell press. So you're going to be laying on your back like you're doing a chest press. You're going to want 30% of your weight in one arm. So we're doing one arm at a time. So once again, if I'm 200 pounds, I want 60 pounds. One side, I'm trying to do 8 chest presses. If you can't do that, then that's probably the issue. If you can do that, then we do more medicine ball training, stuff like that. Core is a little trickier to test the strength. Sometimes I'll do 30% body weight, like a sit-up type movement of holding it over your head. TPI likes to do a bent over row. So once again, if I'm 200 pounds, I'm going to use a 60-pound weight. And I'm just bent over like this, having to stabilize through my core and coming up through here doing 8 repetitions each way because my core's having to stabilize me to be there. Honestly, with core training, it's all pretty similar. I'm not doing a ton of heavy core training with folks. It's more movement-based and things like that. So that one I tend to fudge a little bit. But the upper body and lower body, it's good to have an idea because at the end of the day, we want to look at your training and say, okay, you lack lower body power. What can we do to make that better for you? Not just a generic program. If you're someone who needs to get stronger, then that should be the focus. If you're someone who just needs to work on your speed, that should be the focus. So we want to take the power, bring it to the weight room and say, what are we missing? Is it a strength issue or is it a speed issue? So the final assessment that I like to include is mobility testing. So as a physical therapist, this is kind of where I shine because we do a bunch of mobility testing. It's part of every assessment we do, pretty comfortable with it. The mobility testing is honestly the most individualized part because it's the last one. So I have kind of watched you move and I kind of know where your limitations are, what I'm going to look at. Oh, it looks like your shoulder's tight, your hip's tight, whatever it is. Obviously with baseball, it's a very rotational sport, throwing, swinging, everything like that. So we're going to want to look at rotation. Does your thoracic spine, your pelvis, your shoulder, your hips, do they all rotate well to let you achieve your goals of swinging hard, throwing hard, all that kind of stuff, and obviously doing so pain-free. A couple easy assessments that I like to look at would be thoracic mobility, so the middle of your back. So I'll just have someone sitting on a table with their knees and feet squeezed together, hands on the opposite shoulders, and then just rotating one way, keeping those knees together, and then rotating the other way. Now, I want to see at least 45 degrees of rotation. So 90 degrees would be you turn your chest all the way here. 45 is somewhere in between. Ideally, I want to see 60 degrees because, like I said, baseball is a very rotational sport. So kind of splitting the difference between halfway and all the way there, and it should be equal on both sides. We've talked before about the asymmetries of baseball. So what I'll see a lot of the times is people move really well to one side, other side's a little stiff. That could impact your performance, and we want to mobilize the other side. The other thing we want to look at for arm health is shoulder mobility. So external rotation or layback, getting back here, obviously crucial for pitchers, is if I'm standing here, I should be able to just stand and rotate my arm back with my elbow at 90 degrees past 90 degrees here. I don't want to see you when you're rotating get to here and be surprised when you're trying to throw and you're not able to get back. You're losing velocity, you're losing control, everything because you're just having to whip your arm back in a position you can't normally hold. So shoulder mobility here, thoracic mobility here are two exercises that I look at. There's obviously a million depending on the athlete, but those are just two that I like to highlight. So that was a quick look at how we run assessments at Eclipse Wellness in Sterling, Virginia. Like I said, assessments need to be thorough. So our typical assessments are about an hour one-on-one to really dive into the power, the strength, the mobility, and what makes you move as a baseball player and what we can improve upon. From a training perspective, assessments are useless unless you can correctly interpret them. That's the other big mistake I see with folks is they get these fancy assessments and then they end up doing cookie cutter programs based on them. What we do at Eclipse Wellness is we use your assessment, we look at it and we say, what do we need to train? The way I typically break it down is we're going to train strength first because if you're lacking strength, it doesn't really matter, you're not going to get power. We look at strength, then we look at mobility because if you don't have the mobility to get in positions, you're not going to be able to access that power that we're working on. Strength, mobility, and then finally we look at power. If you've got good strength, if you've got good mobility, then we can start training power more. Obviously, it also depends on the athlete and what they're missing. We'll kind of tailor it towards that. In general, as I mentioned before, with younger athletes, we're going to tend to try to look at everything, make you as well-rounded of an athlete as possible. The older you get, the more specific we might get with your individual needs and what you're trying to improve on as an athlete. So that's just a brief summary. Like I said, typically assessments take an hour, so this is just a little snippet of it. If you're in the Sterling, Virginia area and want to come by, reach out. We'd love to have you at Eclipse Wellness, whether you're a coach, a player, anything like that. Talk about assessments, do an assessment, make a plan so you can dominate your off season. Thanks.